Okay, so I hope everyone see my slide clearly. Is that right?
Yes.
Okay, thank you very much. So good morning to all. My name is Tin Ruikchuchit. I'm studying in Master of Science in Dermatology from Chulaphon International College of Medicine, Thammasat University. Today, I'm presenting you my proceeding, which is vitamin D in Thai acne patients, a cross-sectional study. Vitamin D is a fat-soluble vitamin which maintains calcium homeostasis and has important role throughout the body, including cell growth modulation, immune system, and anti-inflammation. A small amount of vitamin D can be obtained from foods such as egg yolk, fatty fish, and fortified milk. Vitamin D synthesis was from ultraviolet B radiation to skin, convert 7-dehydrocholesterol to vitamin D3 or cholecalciferol. Then it is metabolized within the liver to 25-hydroxyvitamin D, which is used for vitamin D level assessment in clinical practice. Then within kidney, it converts to 125-hydroxyvitamin D, which is a biological active form of vitamin D that influences many organ systems accordingly. Vitamin D status has been found to link with several skin disorders such as psoriasis, atopic dermatitis, vitiligo, alopecia areata, and acne. This study focuses on acne vulgaris, which is a common chronic inflammatory skin condition. It affects people across the world. The pathogenesis of acne comprises of 4 principal factors: excess sebum production, abnormal keratinization, Cutibacterium acnes overgrowth, and eventually lead to chronic inflammatory responses. How vitamin D takes part in acne pathogenesis? The vitamin D receptor plays an important role in immune system regulation as well as the proliferation and differentiations of keratinocytes and sebocytes. Vitamin D supplements has been shown to reduce the expressions of interleukin 6, 8, and metalloproteinase 9, as well as to inhibit C. acne-induced T helper 17 differentiation, and also has antimicrobial property by inducing antimicrobial peptides in sebocytes. Even though Thailand has year-round sunshine, which may contribute to low frequency of vitamin D deficiency in general population, but recent days we found that vitamin D deficiency was more prevalent than before from change in our daily lifestyles. Acne patients may have concealed low vitamin D status. There has never been a study in vitamin D status conducting among acne patients in Southeast Asia, specifically in Thailand. Therefore, we would like to evaluate vitamin D levels among Thai acne subjects and relationship between vitamin D levels and acne severity. This was a preliminary research using cross-sectional study. We recruited 20 subjects aged between 20 to 45 years with the diagnosis of acne by dermatologists at the Skin Center Benjakiti Park Hospital during June 2021. We assess patient acne by using the Global Acne Grading System score. This system divided face, chest, and back into 6 locations, then grading on a 0 to 4 scale, depending on the most severe lesion within that location, multiplied by the area factor, and the total score are then classified as shown. And for the vitamin D, we tested for 25-hydroxyvitamin D total levels collected from blood sampling, which will be analyzed by electrochemiluminescent assay. The definition of vitamin D status were shown in the description. Results for baseline characteristic. Mean age was 28 years. For genders, 35% were male and 65% were female. 65% had mild acne severity and 35% subjects had moderate acne. None of the participants had severe acne in this study, and the mean duration of the disease was around 12 years. After patient's consent, we measured the serum 25-hydroxyvitamin D levels, and it ranged from 11.1 to 25.1 nanograms per milliliter, with mean of 16.85 nanograms per milliliter. We found that vitamin D deficiency was around 70%, and the other 30% had vitamin D insufficiency. Surprisingly, no one had adequate levels of vitamin D. If we divided subjects according to their acne severity, Mean vitamin D levels were around 16 in both mild and moderate acne. For this figure showed a percentage of patients in various vitamin D status divided by their severity. 69% and 71% of subjects were vitamin D deficiency in mild and moderate severity, respectively, and none reached adequate levels of vitamin D. We also evaluate relationship between vitamin D levels and acne severity and found that there was a low inverse correlation between GAGS score and serum 25 hydroxy vitamin D with the R value of minus 0.199. However, the p-value was not significant in our study. And for digital photographs, these are pictures of patients with various vitamin D levels. The lesser the 25 hydroxy vitamin D level, the more the severity of the acne. For discussion, this table shows comparisons of study about vitamin D in acne. This study showed mean vitamin D levels range from 8 to 28, while our research revealed mean vitamin D levels of 16.85 nanograms per milliliter, which value within the range of prior studies. And up until year 2019, vitamin D deficiency were in acne patients around 34 to 48%, while later, like our study in 2021, show up to 70%. This may be a consequence from Thai population vitamin D status. There was a Thai research done in 2008 with healthy participants. They discovered that vitamin D deficiency was around 64% among participants who live in Bangkok, where people had lower vitamin D than the rest of the country. The average serum 25 hydroxy vitamin D concentration was about 25.9, and there were multifactorial involved in this, including the urban air pollution is likely to absorb UV rays and altering cutaneous vitamin D production. And also during the coronavirus epidemic lockdown period, people were encouraged to stay in their accommodation that might eventually resulted in a high number of patients who had inadequacy of vitamin D. And last one is about vitamin D levels and acne severity. Our study showed low inverse correlation corresponding to other studies that also report a negative correlation between vitamin D level and acne severity score and acne inflammatory lesion counts. For limitation of the study, we were able to evaluate vitamin D among acne patients only in mild and moderate severity, small sample size and lack of comparing healthy controls. And other limitations were uncontrollable increasing mask wearing R due to coronavirus pandemic. This might aggravate acne from irritations, and also the lockdown period led to avoidance of spending time outdoor. For recommendation in clinical application, due to high prevalence of vitamin D deficiency found among participants in our study, we might consider a discussion with the patient for the need of vitamin D status assessment or maybe prophylaxis of vitamin D supplement. For further study, larger sample size and comparing healthy control could help improve the accuracy of the results. And the future study on vitamin D supplement efficacy might help confirm the findings and discover the best treatment methods in acne management relating to vitamin D deficiency. For conclusion, vitamin D deficiency was frequent among Thai acne patients, with none of our participants had sufficient level of vitamin D. Vitamin D level show a trend of low inversely correlation with acne severity. And that's all of my presentation. Thank you for your attention. If anyone has questions, please let me know.
Okay, great presentation. As Dr. Monia is still here, so can I ask you about the climate in Sweden? Is it related to the acne severity over there?
My apology. Are you asking me?
Yeah.
Can you please repeat your question then?
Because we discussed about the acne and vitamin D, and as you are in Sweden, which have the climate, and in winter and in summer it's very different. So do you have any notice about the severity of the acne there in the population?
One factor that we need to consider is that general population in like regularly using vitamin D tablets, like the supplements during the autumn and winter. So it's like usual practice that like most people are using. Sometimes some people with non-Swedish background, they are like not that perhaps not as a routine to use it. So I'm not very much updated just about the like skin problems, but considering that people like general population using a lot, and also there is here there is like the light rooms usually in the workplaces, so you can go get artificial light. So in workplaces or like in the general public places, so there is some helps to compensate this lack of sunny days during the year.
Okay, thank you very much.
Yeah,
because in Thailand it's like light is every day, even in season.
But isn't it like that in some countries that they have more light, people use more protection,
yes,
expose
actually
much less? But in Sweden, if it comes like 5 minutes sun, they call it like the sunflower. Everyone goes outside and expose themselves. They are taking to more clothes off to get the sun. So they are like more thirsty for the sun. So perhaps it's like in some way balance it, because we need not very many minutes per day.
Yeah. And the Asian people just prefer to have the light skin, something like that. So we just keep avoid. You know, both the presenter and every audience, about 10 years ago, there was a research about the vitamin D level in dermatologists, So it's not surprising. It's everyone, I mean, almost everyone, about 90% of dermatology got vitamin D deficiency.
Yes, that's
wow.
right.
Including 2% among the specialists. That's a huge number.
Yes, because we just keep avoid go directly to sunlight. When we go to the beach, we just put on the sunscreen, just about
clothes cover,
something like that.
And the workplace is like indoors.
Yes,
also.
Yes,
that's right.
Yes, okay. Dr. Tin, can I ask you? It's about the relatively about the hormone and the vitamin D. Any relation? Because the third patient that you show us, I think she have some like the cushingoid face, which is maybe reflected the hormone and the severity of the acne.
Yeah, there might be some influence from hormonal effects, especially for women. So for the inclusion of the study, actually we're trying to exclude the patient with the history of PCOS or polycystic ovarian syndrome. But however, the exclusion criteria is only depends on the history from the patient itself. So we didn't evaluate all of the physical examination or maybe ultrasound to the included patients, but that might affect. But we're trying our best to exclude the hormonal influence from confounding. That might happen.
Okay, because we have the humid and hot weather, so it can the other kind of the confounding factor for the for your study. Okay, all right. Thank you very much. Any